Delegates, I'm honoured to be here today to endorse the 6-point charter of the Build a Better Future campaign and move the workplace resolution outlined by President Jed Carney. This year spells another budget disaster by this federal government. Workers, women, young people and the vulnerable continue to be casualties of this government. Unemployment is on the rise, but there's no concrete plan for jobs or education. There is a growing ageing population, but no constructive dialogue around health and ageing. And women and working families will be worse off under this government with cuts to paid parental leave and family tax benefits that are far greater than the government's investment in childcare. As the leader of the union that represents 60,000 nurses and midwives in New South Wales, we are affected by these issues. But delegates, we are all affected by these issues. Workers' rights, Medicare, education, public services, a secure retirement, and of course, we want a fair go for all, and we will do everything in our power to defend our living standards. As frontline health professionals, we feel strongly about our universal health system. It should not be undermined by any government. Our council, our delegates, our members have voted and are voting to campaign at work and in the community to defend Medicare and public health and to push back against privatisation and user pays. We will fight with every ounce for penalty rates and our rights at work and a decent retirement. This year's budget disaster is, we fear, another nail in the coffin for universal access to healthcare and public health. Health cuts this year include a further $2 billion in cuts to the public health system, on top of the forecast $57 billion announced in Budget 2014, including child dental benefits schedule cut, preventive health care cuts, mental health cuts, drug and alcohol program cuts. There's been a 4-year freeze on Medicare rebates and a yet unknown increase on the scripts from the pharmaceutical benefits scheme as the government continues to flip-flop on this issue. But their intention is clear. They are ripping billions of dollars out of healthcare and turning our world-class public health system into a for-profit driven industry, just like the United States, where healthcare costs are astronomical and health outcomes worse. Medicare will become a safety net for the poor, particularly if the co-pay by stealth of rebate freezes continues. This will surely kill off bulk billing as we know it, as GPs become tax collectors and pass costs onto their patients. Australians are already amongst the highest of the OECD countries for out-of-pocket health costs. Medicare is under attack and we must do everything to prevent it from being undermined. To this end, we demand that the federal government keep Medicare universal, keep Medicare fully funded, keep it public, and ensure that private health insurers are not given access to GPs so that they can control which doctor you see and push up costs for the uninsured. That is the quickest way to a US-style managed care model. And thousands of jobs are on the line if Medicare processing systems are outsourced. This would further undermine Medicare service delivery. We must say no to the privatisation of Medicare processing systems and support our brothers and sisters at the CPSU. And of course, if you want to find out more about the attacks on Medicare, attend the Fringe event workshop from noon to 1 in the Laureate B today. So while Medicare is a key concern for us, we are committed to the campaigning around all of the 6 key issues that define the ACTU's Build a Better Future campaign. Workers' rights. If penalty rates are threatened and removed by the Productivity Commission or the Fair Work Commission, it would have a disastrous impact on nurses and midwives and the provision of healthcare in Australia. A cut to nurses' penalty rates is almost a 30% cut in take-home pay, or for many, around $470 per week. Our rights are being further attacked by the denial of access of nearly 100,000 nurses and midwives nationally to the government's 18-week paid parental leave scheme. And what's worse, these hard-working women are being accused of being rorters and double dippers. In education, more than $40 million has been cut from aged care workforce development, scholarships and training at a time when Australia urgently needs 20,000 nurses to meet the challenge of a rapidly ageing population. The Abbott government has also kept its plan for university deregulation in this budget. These plans include full deregulation of tuition fees and a 20% cut in funding effective 1st of January 2016. That will make it even tougher to ensure quality university education for trained nurses and midwives, and when they do complete their university training, they'll be burdened with huge debt, like so many other professionals that our country relies upon. Our public services. In New South Wales, of course, we are battling a government that seems to be determined to hand over our public hospitals to private corporations, let alone the poles and wires. This is well established in Western Australia and is underway across our nation. Of course, we know the federal government is also paying states billions of dollars to privatise assets and services. A real rush to the Americanised system. We want a secure retirement. The Australian Human Rights Commission has identified the gender gap in retirement savings as a key issue that needs to be tackled. With more than 92% of our membership being women, we will campaign to ensure that the gender gap is closed and that women are not living out their retirement years in poverty. We want a fair go for all. The Nurses and Midwives Association have been campaigning for a few years now for a Robin Hood tax. We would continue to lobby federal MPs and senators on the benefits of introducing a modest financial transactions tax or a Tobin tax, whatever way you like to call it, to generate additional revenue for the delivery of essential public services, including health, aged care, education. All of these 6 points define our way of life. Decisions made by government today will have an impact on our future for many years to come. We cannot stand idly by while this federal government slowly but surely whittles away at everything we hold dear and generations of union members have fought so hard for. We stand side by side today with all the unions in this Congress in our unequivocal support for the Build a Better Future campaign. I formally move the workplace resolution to build a better future. We believe Australia is heading in the wrong direction and we demand our government support workers' rights defended and extended with secure jobs, Medicare, universal health care for all Australians, education the highest quality for all Australians, public services owned by everyone for the benefit of everyone, a secure retirement, decent pensions and superannuation, a fair go for all, everyone supported and everyone contributes their fair share of tax. Thank you.